I'm Carrie Schonlaw, and with 5 County, and we're going to talk about hopefully some services that will help you, and I'll kind of go through things as quickly as possible because I know it's getting late in the afternoon. And I want to kind of talk about services in general that are available to the aging population, because that'll help you as a caregiver, because many of these services your loved one can access that can support you. And then we'll talk about some direct caregiver services that are available to you. So, oh wow, okay, that was loud. I wonder if there's a way to turn, that's going to happen through the whole thing. I wonder if there's a way to turn the sound off in the presentation. I don't know, so sorry about that. It was really loud. So anyway, as an older man caring for his wife in Chicago, Illinois said, "I took a vow when we got married 54 years ago, and I intend to carry it out. My only fear is that I will die from exhaustion before she does, and who will care for her then?" And I'm sure we can kind of all experience that. Our area agency on aging, we are about 20 members and growing strong. When I started at the AOG 20 years ago, in our aging services, there was like 4 of us. So we're actually continuing to grow as aging services expand. And we try to make sure that we have a lot of skilled people at our offices to help so we have social workers and registered nurses. Many of our social workers are certified in dementia care specialists, in TRT, and we have a veteran service officer. We have a lot of certifications and a lot of different caregiver supports and services, which we'll talk a little bit about as we move forward. So one of the services that umbrella program that we fund through our area agencies on aging is our Older Americans Act. And that Older Americans Act is funded through the federal government. It was actually established in 1965. And it really is to support the elderly population, people under the age of 60. There's a few exceptions for individuals 55 and older. And then also the spouses of people who are eligible over 60. So I'm under 60, my husband's over 60. So as his spouse, if he were to need certain services, I can access those services as his spouse as well. These programs have no self-declaration of income. They are not means tested. If you are over 60 and you need some of these services, you're eligible to receive those supports based on that need. The biggest ones, we all know about our senior centers. We have 13 senior centers in the 5-county area. Just as a note, we cover Washington, Iron, Beaver, Garfield, and Kane counties. We cover over 17,000 square miles. So our staff does a lot of traveling to support the seniors in our communities. So there are 13 senior centers in the 5-county area. There's also 3 additional meal sites where there's not a full-blown senior center, but they provide some meals at those sites. So senior centers are a great source for our senior population and for you as caregivers. We talked earlier about meals and not maybe able to prepare meals anymore or getting that nutrition. You can get meals through your senior center. So if you're able to get to the senior center and healthy and able to travel to the senior center, you can go to the senior center with your loved one and have a meal. That's a way to get some nutrition, and on top of that, be able to socialize. We talked about the importance of socialization, being able to get out to the community for a loved one that you're dealing with the dementia. So being able to go out and have that meal. If for some reason they're homebound, you can no longer get on home, they can deliver those meals to you. So if you're eligible that way homebound, they will not only bring the meal to you, but as their spouse, you're also eligible to receive that meal. So we have those congregate meals and home delivery meals. They do transportation at our different senior centers. The level of transportation is going to depend on that senior center and the funding they have. The Older Americans Act has a limited amount of funding. So the counties have to then match that money to help support the programs, and so the counties have limited money as well. So there are some limits on that transportation, but you can contact each of your senior centers and find out what that transportation is that is available in your community. Some of them are able to transport in Washington County at the St. George Senior Center. They transport usually every day they're open. Some of the other areas, they may only transport certain days of the week or month. So, and sometimes in those rural counties, they'll travel into Cedar or St. George for some of the bigger shopping once or twice a month. So you have to just contact your local senior center. They do all kinds of preventative health. So to keep yourself healthy, to maybe keep your loved one as healthy as possible, they do all kinds of exercise classes and Zumba and Tai Chi and yoga and kickstick, and there's pickleball. There's all kinds of fun things they do at the senior centers. Plus they do health prevention programs. So there's programs that teach you how to manage chronic conditions, how to manage diabetes, how to manage falls. There's a stepping on program. There's a variety of programs that can help, as well as some health screenings that are at the senior centers. Socialization, again, a way to get out and do some things with your loved one to get them out and to get you out into the community. and then a variety of educational supports. There's that big noise again, sorry. After assuming an 82-year-old man who visited their center was looking for help for himself and learning he was looking for help for his 103-year-old mother. Caregiving can happen at any age and can continue for many years. So we've seen that. There's caregivers, there's grandchildren caring for their grandparents. There's parents caring for their children. There's children caring for their parents. I mean, there's just a variety of siblings caring for each other. It can happen at any time to anyone at any place. So we have a variety of home and community-based services that can help support you as a caregiver. We specifically have a caregiver support program, which we'll talk more about in a moment. We also have in-home services. So your loved one may qualify, depending on their situation, for actual services that we can bring into the home. And we're going to talk about some of those programs. One of those programs is called the Alternatives Program. It's a state-funded program. It serves individuals 60 years and old and over. We can spend a small percentage of our money on people under the age of 55. So under the Act, we're allowed to spend about 25% of our total funding for people under the age of 60 who maybe have a disability. It is based on an income and asset limitation. Unlike the Older Americans Act, this does look at means testing. So this is a program to serve low-income individuals. It's usually around 125% of poverty. However, we are allowed to look at certain deductions. So we can look at a person's medical expenses, their housing expenses, their other living expenses, burial plans they may be paying. To help them, we can offset those costs that they have against their income to potentially qualify them for those services. So we encourage people for any of our programs to contact us. We'll screen you for those services to find out if you may qualify. Because many times you think, oh, I wouldn't qualify. And sometimes we can qualify people that may not. There is a little sliding scale fee, so if someone is a certain percentage above poverty but still qualifies under the income limits, but they may have a slight fee each month, so they may pay $6 or $20 each month for the services that they're receiving. We do an intake with our staff, so I'll give you a call our office. One of our social workers that's on call that day would take that intake and ask some questions to develop that intake to determine what your needs are and the needs of your loved one. And then that client must be at what we call a medium to high risk score to qualify for those services. If they qualify, then we're able to look at need. These are, again, it's funded by the state and federal government, so there's always limits on funding. So there are at times waiting lists, but that waiting list is not based on a first come, first serve. So if you call me today and we do an intake with you, and your risk score for your loved one is 25, and the highest person on our risk list is 24, you're going to the top of the list. It's not based on first come, first serve, it's based on those individuals with the highest need. So when we have available funding, someone comes off the program or we give some additional funding, we're going to serve that person who has the highest need first. That's who's going to come off that program. So we still encourage, even though there may be waiting lists, that people call. Because if you're not on the list, if we don't know about you, we don't know who you are, we're not going to be able to serve you. So we want to encourage people to call us and get that screening done. So what can we provide? We provide case management. That's a case manager, social worker that's going to visit with you on a monthly basis at minimum, more often if needed. It's going to help you develop a care plan. So they're going to look and assess your needs and your situation and develop a comprehensive care plan around the services that you need. Then they're going to implement services either through the program or through other community services to make sure that the needs of the loved one is met. So we have home health, so we can do an aide. So we have an aide come in and do baby and personal care. We can do homemaking, companionship. A companion can just be someone to come in and entertain your loved one or provide respite for your loved one or do activities or socialize. A companion can also help with transportation and take the individual out or take you out for shopping or errands, those type of things. Secondary meals would be, again, another option to help provide meals into the home. Chore services, equipment and different environmental accessibility devices, emergency response systems, medication reminder services, respite. So that's a key one, again, as a caregiver. If your loved one qualifies for this program, we can provide respite under that program. That respite can be in the home or in a facility. So we look at your individual needs and what best meets that need, and then we make that determination. One thing with our alternatives program under state funding, it's typically limited to up to $750 in services per month per individual. We can make some exceptions depending on the situation, but overall, once the kind of person hits that $750, we have to look at whether or not there's other services that we need to bring in or look at other options for their care. We also have waiver programs. And the waiver programs are Medicaid programs, so they're typically for low-income individuals, but again, what I want to emphasize with these is under the Medicaid waivers, unlike traditional Medicaid, we can qualify individuals who would not normally qualify for regular Medicaid. So we get people who say, I applied for Medicaid, my income and assets are too high for me to qualify for Medicaid. We'll say, well, this is different from that. This program is going to look at other things such as what they call a spousal impoverishment provision, meaning that we do not want to impoverish you as the spouse in order for your loved one to be able to receive services. So they're going to allow you as the spouse to keep some higher income and asset limitations than would normally be allowed under regular Medicaid to then qualify you for the program. There's also some medical and living expense deductions that may not typically be allowed under regular Medicaid. There's a there's a possible spend down. So say that under regular age Medicaid, there's usually not a spend down, which means you can't pay in towards the cost of your care. But let's say that they qualify you in and you're about $100 over the eligibility criteria to meet the eligibility. They're going to say, well, under this program you can still be eligible, but what you're going to do is pay a spend down. So each month you're going to pay that difference from what you're eligible, that $100 each month toward the cost of your care. It's almost like thinking of a medical monthly premium that you might pay to an insurance. So basically what you're going to do is pay that difference each month to Medicaid to be able to receive these services. In many instances it's worth that to individuals because they can keep their loved one home and pay a few $100s extra a month towards the cost of that in-home care rather than having to put their loved one in a facility where all of their income would be taken. So there's some things that way that we look at with that Medicaid eligibility. So again, we don't go too detailed into that. You can call our office, we'll screen you for that. Or if it looks like you're going to qualify and there's funding to put you on the program, we will help with the Medicaid application and help you through that process. So again, it provides a variety of in-home services. The nice thing about the waiver program is that unlike the alternatives program where we have a cap on how much services we can put in each month, there is no cap on services under this program. As the needs of your loved one increases, we're going to assess that need and that increase, and we're going to implement additional services to keep that person at home. At the point that we feel the person is no longer safe with all the services we put in, we may have to then consider alternative options, such as a long-term care facility. But as long as we can assure their safety in the home, we will continue to put those services in to help meet their need. And that case manager, that social worker is going to help through that whole process on a regular basis. So those are the kind of types of services that are available. New Choices Waiver is a program, it's similar to Aging Waiver. It's a waiver to the Medicaid program. But this program's intent is to help people who are already in long-term care be able to either come out of the nursing home and into a community setting, or in certain circumstances allow them, if they're already in assisted living, to stay in that assisted living after their finances have been expended, their personal money has been expended. So I'm not going to go into the nitty-gritty of all this, but the main criteria is that they have to have been in a long-term care facility for at least 90 days or more, or in a assisted living for 180 days or more. And then if they meet certain criteria, then they may be eligible to come onto the program. This program, different than the aging waiver, is that in addition to all of the in-home services, under this program we can pay for assisted living level of care. So an aging waiver, once they meet a need of no longer being safe at home, we cannot pay for assisted living care. We have to then transition them either to New Choices Waiver or a nursing home. This program, if they need assisted living level of care, we can put them into assisted living under this program. This program will help cover the costs of assisted living level of care. Friends through discomfort and family through denial deserted us, and we were left alone and lonely. As angry at the world, I was dutifully changing diapers, bathed, and dressed. The man I was once lover to, how many years ago. So I think we can all kind of relate to that as caregivers, of what that does and how that changes the dynamics of our relationship, but that we still love this person and want to be able to provide those supports. So our National Caregiver Support Program is focused solely on you as caregivers. That's who we are supporting here. You are our client under this program. The other programs, your loved one is our client. We're helping you, but our loved one is the person that your loved one's the person we're supporting. This program, we're supporting you. So we can do a variety of things under this program. We can provide information and outreach. So coming out here today to talk to you about the services in our community. We can do what we call some kind of trainings and education classes and information just about services in the community. One of the programs we do is called Making the Link, and we take these packets to physicians' offices. There's one packet for the physician, and we give that to the physician's office that talks about caregiver services and needs in our community. It has information about our agency, about Memory Matters, about the Alzheimer's Association, about Red Rock Center and their respite group. So it talks about the services, and then there's a book in there for the physician that talks to him about how to talk to their patients and their caregivers. So we give that to the physician. We give him a stack of the other caregiver packets for him to give to his caregiver. So hopefully we've had more increases lately from physicians for this. It took us a few years to get it off the ground, right, Luann? Luann's been working with me on this for many years. And at first it was a struggle to get physicians to really understand the purpose of this and the importance of this. And in the last 6 months, I think we've distributed about 350 caregiver packets total. And we've got more requests for more. So hopefully we're going to get the word out to our physicians about educating and helping their caregivers and not just their patients, because the caregivers in these circumstances are as important as the patient in making sure that those care needs are met. We can do assistance in case management, and then, which again is our social workers that can help provide support and assistance to our caregivers. We do counseling and support groups, and I'm going to talk about some specific programs that we do. We have monthly caregiver classes. We can also do what we call long-term care options counseling. It's really where just a social worker can sit down with you one-on-one and talk about everything we've talked about today. What's your long-term care issues? What do you think you see for the future? How are you going to plan for that future? What are the services that are available? How can we connect you with some of those services? So there's an option of kind of walking you through those steps of helping you prepare for what the future is going to hold as a caregiver and how to meet those needs. So I'm going to talk a little bit about the RCI and the dementia dialogues. We can do respite services, so we can provide respite to you. This respite is funded, and the good thing about the respite again is there is no income or asset limitations. This is any caregiver over the age of 60, either themselves or their loved one is over the age of 60, unless you have an Alzheimer's or dementia diagnosis, and then we don't look at age at all. So if your loved one, if you're caring for someone who has Alzheimer's or dementia, we don't care what the age of the caregiver or the care receiver is. We're going to be able to provide that respite under the program. We can provide up to 1 year or $1,500 of respite. And what that really does is help kind of connect you and teach you about what respite is, give you that respite option, and then our social workers during that time will help connect you to resources in the community and connect you to other respite options, such as Luann's or Red Rock Centers or other ways that you can access that respite services. So if you have the financial means, they'll talk to you about how you can financially pay for respite on an ongoing basis. This really is intended to help kind of educate you and provide that initial respite and then teach you how to access those other services. We have a variety of supplemental services that I'll talk a little bit about, music and memory and our memory activity kits. So RCI Reach. So RCI Reach is a training program that we have. This is an evidence-based program that is through the Rosalind Carter Institute. And this program is called Resources Enhancing Alzheimer's Caregiver Health. And so this is a one-on-one tailored program with a trained interventionist. So I think we have 5 or 6 social workers now trained in this intervention. And they can go into they do 12 sessions over a 6-month period. About 9 are face-to-face and about 3 are over the phone. They can adjust that depending on your situation. But they can go in and they provide specific topics each time. They talk about different behaviors, about different things that you're dealing with, what they call trigger behaviors, or things that you're facing right now at this moment that maybe can help you in dealing with that Alzheimer's or dementia. So they look at the program objectives are to improve your overall caregiver health and depression, reduce the feelings of burden, improve the caregiver management of troubling behaviors, and then hopefully delaying that institutionalization. So they give information on the disease, we do skill training, dealing with wandering, repetitive questions, agitation, a lot of the stuff we talked about today, but this can all be done one-on-one with you as an individual caregiver with the specific situations you're dealing with. Yes?
And what is the cost for this specific class?
Not a penny. So she asked what the cost was. In our area, when we do it, at this point, we fund this under our caregiver support program, and at this time, there is no cost for a caregiver to participate in this program. So again, stress management information. The other thing that the caregiver gets at the end of it is our nice caregiver book that the Rosalind Carter Institute put together, which talks about all the issues. It has places it talks about. So, you may be dealing at the moment on specific trigger behaviors, but maybe after our social worker's gone, something else comes up. This book you can reference and you can go, oh, gosh, I'm dealing now with wandering. And there's this place in this book that talks about how do I deal with wandering? What's some ideas? What's some things that can help me deal with that issue? Our social workers and case managers, even after the 12 sessions are done, are always available. You can call them. They're not going to hang up on you and say, sorry, you're done. But, so they'll help you. But this book is kind of that immediate resource for you. So it's a great tool. Dementia Dialogues is a program that we worked with the state on, and with Lynn Miner and with the state coordinating council. And she brought in a person that developed this program to train people in the state of Utah. So we were trained over a year ago for the initial training, and then we sent some more staff this last time. So I think we have 4 or 5 now. Okay, so we have 6? How many? 6. We have 6 now of our case managers, our social workers trained in this Dementia Dialogues. Wonderful program. We've had physicians to participate, caregivers, we have professional caregivers, we have family caregivers. And what this program is it can be done at one day over, so for the full day, we can do all 5 sessions in one day, or sometimes we can do it every, one session for 5 weeks. We can do 2 half-day sessions. So we kind of develop on what the needs of the community are in the situation. I know that our case managers that have kind of done it have found that the one day is kind of the most successful format, but we can do it in a variety of options to kind of meet the community needs. So, depending on the situation and what the caregiver needs are. This one will go over some basic issues with Alzheimer's and dementia. So they talk about the basic facts, which is an introduction to dementia. They talk about keeping the dialogue going, so strategies for effective communication. It's a different world, understanding the impact of the environment and ways to promote independence and activities of daily living. It's nothing personal, addressing challenging behaviors, and then now what to do. So creative problem solving. They talk about options of problem solving. And the nice thing is, again, it's made up typically of a variety of people, family caregivers, professionals. We had one group where we had a physician there, and we have family caregivers, and we had some people from assisted living, and there's just a lot of good conversations going on in the group. And caregivers can talk about concerns, and professionals can hear that concern, and it's kind of a real good interactive dialogue. It really is a dialogue about dementia and what happens with that dementia. So we've done, 7 or 8, 9 classes in the last, 2 years and a half that we've been doing the program. We're kind of on a little time off for a little bit for the holidays and with some funding things, but we hope after the first of the year we're going to start up some classes again, because Sherry's like, I've already got a waiting list. People are already calling, and physicians are calling us, which is really exciting. So we're getting physicians referring their caregivers. So we're very excited. So we're very passionate about keeping this program going. We have other caregivers. We have monthly classes that go on throughout the community. We have a monthly class at Balaterra on the 3rd Thursday. We do that in conjunction with Memory Matters. We have a class at Brookdale on the first Tuesdays at noon. One in Cedar City on the 2nd Fridays. And right now in Hurricane, we've kind of had the caregivers kind of dropped off right now, so we're kind of on a little hiatus, and as we have a need for that. And then there's now a caregiver support group going on in Kanab. Where's my Kanab lady? Yeah, Nancy does the Kanab one, and then we have someone that was here earlier from Kanab. And then we also now have one going on. There's a caregiver support group going in Escalante, right? It's these ladies in the corner here. So we're getting those groups going out throughout the community. Then coming in 2018, we're going to be working on what's called the Caregiver Academy. And we're going to do these in conjunction with our monthly caregiver classes. And this is a program that was developed by Salt Lake County Aging Services, and they've had great success with this program. And so they're going to be training us in January. So they're going to send their staff down to train our staff in January. And this one is a general caregiving class. So it's for any caregiver, whether they have Alzheimer's, dementia, or whether they're caring for someone with a stroke, or it's just a general caregiving. It'll talk about essential skills for managing the family care environment, things like caregiver resources, compassion fatigue, building resilience, setting good care boundaries, family dynamics, involving the family, coping with difficult behaviors, and in-home and facility-based care choices. So there's a different thing each month, there's a different session and topic that they go through this academy with. So we're excited to bring that to our community in this next year. Other things we have reminiscent activity kits, and Sherry Rubber in the back is also a TRT, recreational therapist, the therapeutic recreational technician. She's taken that skills, along with her skills as a social worker and her expertise in dementia, and has developed these caregiver toolkits, these reminiscent kits. And each kit has a different type of theme, such as cooking fishing, cooking, crafts. I mean, there's just a whole different variety of themes. And she's developed these toolkits. We have those in our office. We sometimes loan those out to caregivers that are on our respite programs and on our services. But she also has back at our desk a list of those. So she has actually the different kits she's put together and what's in those kits. And those are things that actually are able to give a respite to you as a caregiver when you aren't able to actually have someone come in and give you that physical break. But you might be able to give them this activity kit that they can keep themselves busy and keep them, going during when they're kind of bored or when they're getting, having agitated behaviors and so forth. So we found those very successful. We talked about the making the link.
Where do you have the list of that?
Right back here with Sherry, there's a list of those activity kits. And if you're welcome to contact Sherry or come over to our office. We have samples of them so we can show you the kits and let you see what those look like as well, if you want to kind of have some hands-on with those. We also have them at our office. So, music and memory, we've just been certified. Some of our staff were certified about a month ago, so we're implementing music and memory. If you're not aware of that, that's a program where we're able to have the staff are trained to develop a music library of music that your loved one likes. So we develop a personalized library of music that's familiar and that your loved one likes. And we put that on a little iPod shuffle. We make it simple with headphones, and then that's able to be able to use that with your loved one and put that music on. And that again brings back a lot of memories, lets that person reminisce, can distract them from other behaviors or other issues going on. So it's been a very successful program that's done across the country, and we're adding that to our component of support for caregivers. We also have a variety, I talked a little bit about the evidence-based programs, and so we have a variety of evidence-based programs. If you're interested and able to participate in some of those, they can help with dealing with a variety of different kind of chronic conditions and fall things, and then just some of them are just regular keeping yourself fit and active. And it may be something, depending on the stage of your loved one, that they could also participate in as well. We are considered what they call an aging disability resource site, so we can provide that long-term care options council we talked about. We're kind of that point of entry for anything aging related. So if you have issues regarding aging, we're kind of that first stop for you to say, okay, what do I need to do next? And we either look at what we have available and what your needs are, or we can refer you out to those other agencies. So we really provide that one-stop shop. We also have the long-term care ombudsman. If there's a point where your loved one needs to go into a facility, or if they're already in a facility, we have an ombudsman who is an advocate for residents in nursing homes and long-term care. In fact, one of our ombudsmans back is here today. And what they are able to do is if there's concerns about the care of your loved one in that facility, they can be an advocate for that resident and help to resolve any complaints or concerns. And they can be kind of that liaison, that moderator to help in advocating. And then the nice thing is if there's something going on with you or your loved one, and it's systemic, and it's something that maybe is impacting other residents, they can help resolve that for not just you or your loved one, but for all the residents of that facility. We have veteran services. We have options counseling for veteran services. We have a certified veteran service officer at our office who can help you. So if your loved one's a veteran or you're a spouse of a veteran, then we can help kind of navigate that veteran services and the benefits that might be available to you through the veterans programs. The VA system, if you've had to navigate it, is quite complex, and it's often difficult to navigate. It's often difficult to know who you contact. There's the healthcare side, and there's the benefit side, and the financial side. And if you call one and you want the services for healthcare, and you call the benefit side, they're going to say, sorry, you don't qualify. They're not really good about navigating to the place you need to go, they just kind of say, well, you don't qualify. You know, if you apply to the wrong department, they'll reject it. So this person can help you kind of navigate that process and help you to apply for those benefits, and has been able to get individuals onto benefits, not only to be able to get them monthly pensions, but also been able to get them in services to help keep them at home. So there's some amazing stories we have of successes in that way. We did lose some of our funding for this, sadly, so we kind of had to limit some of what we do, but I've applied for another grant, and hopefully we'll hear in the next month, and we can continue to make sure that we don't have to cut any of that support we have for our veterans. We also do what they call the Veterans Directed Home and Community-Based Program. So this is actually another in-home program for veterans. So it's veterans of any age who now need in-home services. And this is what they call a self-directed program, which means the veteran gets to determine either themselves or their designee. So if they have dementia, that type of thing, you, as the caregiver of the PO, you can make those decisions, but you hire your own individual to care for them. So the VA, if you qualify for this program, allows you then to choose either another loved one, your spouse, a family member, a neighbor, a friend, or you can even hire a professional. You choose who you get to hire, and that person then helps provide that in-home care. So rather than having home health companies or other agencies come in to provide the care, you choose who that person's going to be that provides that care. So we have that program that we provide the case management for. Through the Veterans Administration, there's a paperback at our table that talks about our two programs that we do for veterans. And then on the bottom of that, it gives you this website and phone number. The Veterans Administration also has some caregiver support programs. They have a caregiver support line, they have a peer support mentoring group, they have like an online one that you can participate in on a monthly basis, they have online workshops, they have the REACH program like we do, but for veterans, and that focuses on not only people with dementia, but people with ALS and MS and post-traumatic syndrome and spinal cord injuries. So there's a REACH program to the VA the caregivers may be able to access. They have caregiver support coordinators, and then again, they have all kinds of online tools and resources to support caregivers. If you're trying to navigate your Medicare and Medicaid issues, so if you're on Medicare, which, you know, a lot of, we get that, was at 65, and we get our Medicare card, and we have what we call senior health insurance counselors that can help you navigate that process. So does anybody know what time of year it is? Open enrollment, right? So isn't that fun? To navigate the plans, to decide on a Part D, to decide on a supplement, which one's going to be best for your situation, for the medications you're on. These SHIP counselors right now, during open enrollment, can sit down with you and help you navigate that process. So, and then anytime during the year, if you have questions about your Medicare, if you have a question about a bill, they can help you to go through the claims process or go through the appeals process of a claim. So anytime you can contact our SHIP counselors. And they also do what they call Senior Medicare Patrol, which is then helping inform you about Medicare fraud issues and how to detect and report fraud. And they can do counseling and outreach and education about fraud issues as well. Then we have our volunteer programs. And so I'm going to talk specifically about Senior Companion, but these volunteer programs are individuals, seniors 55 and older who want to volunteer in our communities. And in return for their volunteering, they volunteer in different areas. So some become foster grandparents and they tutor and mentor in our schools. But the one that's most pertinent to you is our Senior Companion program. So we have 55 and older volunteers who volunteer to provide services in the home of the frail, elderly, and the disabled. And they also can provide some respite. So this is a program where you could potentially have a senior companion come in and socialize with your loved one, play games or cards, or even take them out for a drive and ice cream or whatever, or a meal while you get a break. So this is a program that can help that way as the caregiver support. And then our retired senior volunteer program are also volunteers 55 and older. A lot of them are trained are going to be trained to do our evidence-based programs, and they become certified trainers to teach our evidence-based programs. But we also have a telephone reassurance program, and Luann talked a little bit about that program with her agency, and so we will be working with Luann as well as with our senior centers and other agencies to be able to develop a telephone reassurance program where, again, we can call and check in on individuals with dementia or their caregivers or other frail elderly and adults. So that was really everything in a very quick nutshell. So we didn't keep you too long. Is there any other questions? Great, and if again, any specifics at any time, you can contact our agency and we can kind of walk you through any of these particular programs. So, thank you.